Hello, my name is Fiona Campbell. I'm a physiotherapist and one member of the practice advisory team at the college.
Hi, I'm Sherry Hughes. I'm one of the other practice advisors, and not with us today, but definitely here in spirit is the third practice advisor, Kelly Schmidt.
Sherry and I are here today to open a question and answer session for you. Some practice questions we hope will come in live, but we have quite a fair number have been submitted last week, so thank you to those who have submitted them prior to us airing today. We'll also share some of the more common questions that we're receiving from you, from the public, from other stakeholders such as insurance companies, students, physiotherapy assistants. There's quite a number from that group. As you know, the standards from our first slide, they've been revised, they've been updated, and this has been going on steadily over the last 18 months. We can answer questions that you might have about these revised standards and how they will affect you and your practice.
Before we start taking some questions, I just want to let you know that the practice advice team is here Monday to Friday between 8:30 in the morning and 5 at night. The three of us have committed to at least one of us being available to answer your call live that day. And if for some reason you don't get a live person and you get the voicemail, please leave a message and we'll get back to you later that same day. It usually just means that we're talking to somebody else. The service is free and it's anonymous. Just to give you a sense of how many people call, we're so thrilled that last year we had about 3,500 people call. Mostly it's physiotherapists, like around 70%. But we also have assistants and residents and students calling us, as well as members of the public, employers, insurers. Lots of people who have questions about the practice of physiotherapy, and we're happy to talk to anybody who calls. We're actually starting to see a bit of increase in the numbers, which is fabulous. We think that by the end of March this year we might hit 4,000 or 5,000, which is a bit of an increase over last year. We love it. We love that people are calling and asking the questions before they run into trouble. Getting the answer free and anonymous ahead of time is definitely the way we want to go. Fiona's going to tell you a little bit about some of the top questions that we receive.
Yeah, thanks, Sherry. And you said 4,000 to 5,000 callers. It's looking like it might be more than that. And great questions, really good questions. And often you phone with one question, but it turns into about 3 questions, and that's okay too. So a lot of people say, well, what are the sort of most common types of questions that are being asked from the public and also from physios? Well, I'll start with the public. Most members of the public just want to find a physiotherapist in their area, and we'll instruct them on how to use the public register to find a physiotherapist in your area, or they're looking for government-funded physiotherapists, and again we'll take them to the website and we'll walk them through the process of trying to find a physiotherapist who does that. Fees, billings and accounts, that's quite common. People want to know what they've been charged, was it fair, was it reasonable, just questions like that. We'll talk them through the standard and what the physiotherapist is responsible for. They want to know how to make a complaint and the process of doing so. They want to know about working with the physiotherapist, working with physiotherapy assistants. They want to know, is that reasonable? They want to know, is that common? And we'll talk them through the process of involving PTAs and the model of care that physios use. And they have questions about the scope of practice of physiotherapists. They're often interested in what's within limits and what's outside the physiotherapist's knowledge and training. So interestingly, on the other side, what are the top 5 questions from physiotherapists? Well, it's interestingly very, very similar. The issues are similar, but they're viewed from different perspectives. PTs working with assistants, often physios will phone, they'll ask about what the responsibilities, the accountabilities that the physiotherapist has when they're using assistants. The fees, billings and accounts, they want to know questions about how can I do an audit, what's this new requirement for putting the name of a physiotherapist assistant on an invoice. They'll ask about the rostering requirements for controlled acts, record keeping. You want to know how much or how little information is provided or should be provided by the physiotherapist. You want to know, you've got questions about documentation of consent. Advertising, lots of questions about testimonials and the use or the prohibition on the use of testimonials and the claims that you make in advertising. You want to just run it past us. Does it meet the standard expectations? So those are the top 5, very similar from both the public, the stakeholders, and from physiotherapists. And we're happy to talk people through scenarios and issues that arise. So standards. In the first slide, you'll see that long list of 11 standards that have been revised since summer of 2016. You'll notice in these standards, I say revised because Shari was just reminding me they're not so much new, but what we've done is revised the language. We've made them direct. They're very rules-based. We use different terms like the term physiotherapy assistant, not support personnel. You told us physiotherapy assistant. It's more common, so we're trying to use that as well. You'll have noticed that they're considerably shorter, 1 page, 1.5 pages long. So they're concise, they're direct. You told us you wanted standards that you could refer to, that were clear, you could get the answers easily, you can reference them in your busy practice settings, and we hope we've met that goal. But before we start, can we just get a minute just to find out who's listening today? Shari, can you ask a few questions?
Sure. So, like I said, or like Fiona said, we're just keen to know who's out there listening, and want to know so that we can make sure that we tailor our answers to your specific workplace. So can you just let us know whether you work in a hospital, in a private practice clinic, do you work in a long-term care or nursing home, do you see patients in their homes, do you have an administrative role, or do you fall in some other sort of category? So just choose a category and hit submit. And we'll pull up the answers. So, excellent, thank you. We can see that most of you are either working in a hospital or private practice. Half of you in the hospital, a quarter of you in private practice, 5% in long-term care or home care. Nobody in administration, that's interesting, but that other catch-all category captures quite a few of you. We just have one more question. And we're just interested to know, are you out there on your own, or do you have the support of a buddy or two with you in the room? So are you listening in by yourself, or do you have other people with you? And most of you on your own, which is not a problem, but I also really like that there's a whole bunch of you that have the support of another colleague. So thanks for sharing that with us, and we will get right to the questions, I think.
Okay, let the questions begin. Again, type your answers. We're happy to take any live questions, but I also think we should take some of the questions that have been submitted prior to airing today. Really thank you for taking the time. What's the first question, Shari?
So the first question is, if you found, after providing services, can physiotherapists get written feedback from clients with regards to the services they received?
And I would say yes, what a great idea to improve quality of care. Just make sure that when you're asking for feedback, if it's a questionnaire or survey, you get consent. You explain to the patient what the feedback is going to be used for. You cannot use testimonials in your advertising from patients. So that would be a sort of feedback. Be very careful about what you're going to use it for. But ultimately, it's a great idea to improve the quality of care that you provide. Okay, do we have any other questions that we can...
Sure, I've got another one here. If you found out that your employer has been misusing your registration number using the TELUS eClaim Health portal, what are the steps that you can take against that employer, and what kind of assistance will the college provide?
Okay, that's good. No. So listening to that, I wasn't sure if this is just a one-time mistake, an error, or this is a pattern that a physiotherapist has detected. It doesn't say, does it?
The person who submitted the question didn't clarify anymore, but
okay.
that's okay.
Well, the first thing is you've got to correct it. That's a mistake, and you're obliged. You must correct that mistake. So sit down, discuss with the clinic owner the error that was discovered. Email is a good idea, as it will be in writing. It might be a simple error, and so correct it. Contact the insurance, explain what's happened, or the patient, explain it, correct it. And document the steps. My advice is document the steps that you took to fix that error. However, if you notice it's a pattern, or you're concerned, there's something flagging you here, that there's something amiss, you might want to take this further. I would still say discuss with the clinic owner, put everything in writing in an email, make sure you really outline to the clinic owner when and how your registration number can be used for billing. You might want to contact the Insurance Bureau of Canada, submit a tip online. I won't give the web link now, but email me afterwards. I have the Insurance Bureau of Canada's website. You might want to contact the Better Business Bureau of Canada. Or even, if there's a large pattern, you may want to contact the police. We have access to the professional credential tracking, and we can actually check for you. That's sorry, I'm going to have some water. Could you just carry on?
Yeah. So for motor vehicle accident insurance claims, the HCI has, they keep a record of who has entered a physiotherapist's name and registration number into their system for the purposes of billing. And they have given the colleges access to this system to be able to pull a report if a physiotherapist gives the college permission to do that. So if you want to see which clinics have entered your name and registration number to bill for motor vehicle accident insurance, send an email to us. We can pull a PCT, a professional credential tracker report, and you can see who's done that. Unfortunately, it's not available for extended health benefits, but it is available for motor vehicle accident insurance.
And I'm happy to do that. Just send me an email. We can run it through the tracker and send you the report.
I have a question that's come in live, so maybe we'll tackle that one.
Okay.
Someone is asking if the clinic that they work for, the invoice system, I'm assuming it's electronic, is not yet set up to show the assistant's name on the invoice. Is it enough to document it in the patient chart every time the patient comes for an appointment? So I'll start and you can fill in. So no, it's not enough. So in July of 2016, the revised standard made it pretty clear that anytime an assistant is involved in treating a patient, their name and job title has to appear on the invoice. There was a bit of I think there was a time when we might have given some leeway to have that system changed over, but it is coming up on 2 years, and so I'm going to suggest that it must appear on the invoices, and it's not enough to just have it in the patient record. Yes, it also has to appear there, but it has to be on the invoice as well.
And you know what? You can write it on. You can print it out and you can write it on, just the name, the PTA, title on the invoice. That's perfectly acceptable too. Just
make sure that the copy you keep matches the copy that the patient has. So if you write it on, make sure it stays in the system that you have. Okay, the next question came to us in advance, so I'm gonna ask you that one, Fiona. I see that I see that physiotherapists appear to be penalized differently when it comes to suspension of their licenses and whether there's any penalty fee imposed. The person's also saying that the names of those who were found guilty only appear when you look them up, and sometimes is withheld. So they're feeling that there's people are being treated differently, and are asking how does the college determine what happens to people. And I'm going to leave it at that, and you can answer that. So this is about the complaints and system and how are people...
And discipline and the penalties. Oh, thank you. And I have to say the first answer to that is each case is considered on an individual basis. The penalties imposed by committees, they're really based on the unique circumstances of the factors around a particular case. The College Post lists the people suspended or revoked and should not be practising, as well as those facing a disciplinary hearing. So once the physios are found guilty, the information is attached to the person's name on the public register. It's very, very rare to have the name withheld. The only reason to do so might be for maybe a safety reason. But yeah, I would just emphasise each case is considered individually.
Okay. I've got another question that has come in live. And so it's about oxygen. And the question is, do I need to roster for titrating oxygen? And, adjusting levels during gait training, and whether or not you can assign it to an assistant. So the controlled act of titrating oxygen is actually administering a substance by inhalation, and that would include oxygen. Sometimes we say oxygen titration because it's simpler, but really it's administering a substance. And in order to administer that substance, you need to have an order for the substance itself. So if the person is on oxygen and the doctor has ordered them to be on oxygen therapy, physiotherapists who are rostered can adjust those levels or titrate them. But there needs to be an order for the oxygen itself. You can delegate that activity to your assistant if you've determined that they are competent. You'd want to do that formally, make sure that they're competent, and you can delegate them the activity of, adjusting the oxygen to keep the saturation levels above a certain percentage while they're ambulating. The question we get a lot is, do I have to delegate if they're just switching them from wall suction to a portable tank?
I see one question has just come in to that effect.
Oh, good. And so we're saying yes, you have to roster for that activity. Because the controlled act is administering a substance, that would include setting up the system to deliver the oxygen. And if you're switching from wall to portable, you have to set up that portable system to be able to deliver it. You need the competencies to do that. It's a risky activity. Yes, you need to roster to do that. And yes, if you want your assistant to do it, you're going to have to delegate your authority to them.
And I think that makes sense, Sherry, because you're saying to the physiotherapist, you're responsible for that overall training to determine that the assistant has got the training and is competent to deliver safe, quality care to a patient. I think the physiotherapist can determine that very well, and that's why they're given that responsibility and they should roster.
Yeah, agreed. Okay. The next question, Fiona, is about Xrays. We get this one quite a bit ever since the Ministry of Health announced that they were going to commit to their promises in this area. So the questions generally are along the line of, when is this going to happen? When it does happen, do I have to take a course to be able to do it? Does it include things like MRIs and CT scans? And I think that's all of them. When is it going to happen? What do I need to do to be able to order this activity? And what does it include?
Yeah, and I'm looking at, there's multiple questions here about that, and also about lab tests. Some people asking about the ordering of lab tests. So I want to say, yes, physiotherapists, we really are one step closer to having the independent authority to order X-rays, but we're not there quite yet. The change is needed in the Healing Arts Radiation Protection Act, or the HARP, and it looks like it's coming forward by April of this year. But for people with a legal mind out there, there's still more work to be done. There's regulations that also needed to be updated that pertain to only the HARP Act and the RHP Act. They need to be written and they need to be in place before this authority can be fully enacted. So that's as much as I know, and I know that Shenda and the college will keep you updated the more that we hear about the progress towards that. And you asked about the education. I can certainly say this is not an entry-level learning, so there will be requirements for more education. So yes, there's likely a rostering process. Exactly what the learning or education you'll need to take, that's not been determined that I'm aware of. But I can just say yes, there will be more education needed to be taken by physiotherapists who are going to roster to order X-rays. And for those of you asking about lab tests, I think that's going to be considered very separately to X-rays, but we'll keep you informed.
Okay. So it's like any controlled act. Yeah. You have to have the competency. Competency means you need the theory or background knowledge. You need some practical experience under someone's supervision, and you need to be evaluated in some way. It's probably going to be some sort of model like that.
Yeah, and I believe our colleagues, our physiotherapists out on the West Coast, they're taking university courses in their career with exams attached, and they're showing evidence of why they are going to be competent to do this particular act. So
do you have one for me?
I think I'm going to ask you one this time. What are the charting requirements for physiotherapists and physiotherapy assistants when the treatment record is being used in conjunction with the chart progress notes? That came in. That actually reflects quite a common question that we get asked in practice advice.
Right. So the physiotherapist, so this is about what the PT can do and what the PTA can do and how do they manage documentation, I think. And so the physiotherapist is the one who needs to make sure that there's a record of who did things to the patient, what they did, when they did them, why they did them, and the outcome. They're the ones who need to make sure that the patient's record meets the record-keeping standard. And the physiotherapist can certainly have the assistant document what they did, what the assistant did. But remember, the assistants can only document factual information. They can only document what they did, because it's only the physiotherapist that can do the analysis, determine the impact of the treatment, and decide whether there are any changes to the treatment. So I think that answers the question. I don't know, is there anything you wanted to add to that?
No, that seems... I'm just looking to see if there's any more questions coming in. Remember, don't hesitate.
Yeah, not yet. There's one, but I know that we're going to... It's kind of short, so I'm not sure what they're asking, but maybe we'll... I think you were planning to talk about advertising anyway, so let me just... Why don't I flip you that one? So the question just says, what about feedback on the website of the clinic? Is that okay? You know what? This is probably a carryover from the asking patients for their feedback about their treatment from our first question. Okay. I bet you that's what that is. So you what about feedback on the website of the clinic? No, that's not okay. So this would flip over to the realm of testimonials. So if you're having patients provide their feedback to you, that's fine, because you can get that feedback from them. You can use it to improve your practice, but you can't post it on your website. At that point, it would become a testimonial, and you're not allowed to do that. And, you know, when we say testimonial, that also includes patient reviews and patient direct feedback. So, yes, you can ask them and use it to improve your practice, but don't post it publicly, because at that point it becomes a testimonial and is prohibited by the advertising standard.
And I know, I'm thinking as well of some of the questions that come in. You've got a Facebook account, and that's fine to have a Facebook account, but often on the Facebook there's lots of reviews. If there's reviews, disable that function if you're linking to it directly from your advert for your physiotherapy service. Third-party websites, I was just talking to a physiotherapist. Third-party websites, if you've not linked to them, you've got no control, and we don't expect you to have control on like Google review and Yelp. Those are happening independent of your clinic. So if there's reviews, there's testimonials on there and you haven't linked to them, we're not holding you accountable or responsible for those reviews, and that's okay. Just don't link to them. Okay, we've got more coming in. Or shall I ask you one, Sherry?
I'm going to tackle another.
Okay.
Of course, there's follow-up to that oxygen question. It's a complicated one. We get it all the time. So someone's asking if we're just unplugging the portable machine and plugging it into the outlet in the therapy room without changing any sessions, do we need to roster? And I'm going to say yes. And you can argue with me, but oxygen is a drug. It's a risky activity, and you got to know what you're doing. And so if you have the competency to just unplug it and plug it in, I know it seems like a simple thing, but there are some knowledge and skills that are required. And if you have the knowledge and skills to do that, then you have the knowledge and skills to roster for administering oxygen, and you should do so.
It's an entry-level education.
Yeah. Everybody learned how to do this.
We know how to do this as a profession.
So there you go.
Here's another one.
Okay.
Are we okay with the oxygen? I'll move on. Because there's one that came from long-term care. It's kind of interesting. I work in long-term care, and there are times I get referral for braces, like a foot drop. So far, I refer them to CCAC for OT to attend, but it seems wait times are too long. What would be your answer? Is it something a physiotherapist can do? What's the scope of a physiotherapist?
Okay. So the scope of practice of physiotherapy overlaps with lots of other professions. It overlaps with occupational therapy and chiropractic and massage and kinesiology. Sometimes patients will need the expertise of another type of health professional, and sometimes it's something that the physiotherapist can do themselves. In this case, with the braces, OTs don't own bracing. If you are competent to determine someone's need for a brace and order that brace and fit the brace and follow up, then yeah, you can go ahead and do it. Sometimes it'll make more sense to refer them to the OT if they have a particular expertise and you don't. So can you do it? Yes, if you're competent. Should you refer to OT? Sometimes you should, if that's what makes more sense in that circumstance.
I'm just looking, there's a lot more about the advertising, so maybe I need to be a bit clearer on the advertising.
This one?
Yeah, what's the clinic? What's the clinic owner or persons who are responsible for the Google review? I need to reiterate, if the Google review is part of your advert for your clinic to the public, you cannot link to those Google reviews. I cannot comment on a third-party website or who and what's being posted on a third party, but if that somehow is a link or is part of your advert, that's when the rule applies, and I would say no reviews on the advert you have to the public. But I'm not going to comment on a third party.
Okay.
If your town or newspaper does the top physiotherapist or best physiotherapist and you win or are nominated, I am imagining, I've seen a lot of physiotherapists who get Best Business Award or Best, if you think of an example, I think let's talk about the Best Business Award.
Top choice.
It's for Best Business, if you can verify, if that's about your business practices, that is okay. And there is some sort of process that you've gone through or to get that award, and we could verify if we had to, that would be okay. In the advertising standard, you can't have claims of superiority of your clinic over another. So talking about your practice per se, your physiotherapy practice, it's not okay. But talking about, so there's subtle nuances of difference there. Talking about your business practices or the most progressive business in Huntsville or in Toronto might be okay if you can show me data, if you can show that that's in fact the case, but it's not okay to say Shari Hughes physiotherapy is much better than Fiona Campbell. Have you anything to add that?
No, you can say that. You can say, winner of the top choice award.
Yeah, that's a common one.
But you don't want to say things. You just have to be careful when it comes to the winner of the best physiotherapist ever award. So it is a bit of a nuanced thing. So if it's a legitimate award, you have objective evidence that it's an award that you received, fine. Just be careful about using words like top and best and things that are claims of being superior to somebody else.
Yeah. What you could say, so there's lots of advice on what you can't do, but there's nothing wrong with saying Fiona Campbell or Shari Hughes has 15 years experience of treating low back pain, or Fiona Campbell has 5 years experience focusing on the treatment of patients post hip replacement. That's okay, because you're not claiming you're better than the other, but you're still telling the public of the experience and the expertise that you're willing to offer them in a service. So sometimes it's easier to focus on, or try to focus on, what you can do rather than what you can't do. Yeah. So we've got a few more coming in. I just want to check that there's nothing I've said that's confusing anybody, and I want to pick up.
No. X-rays,
no.
Bracing. We can go to the bracing one after this starting a practice one.
Okay.
Yeah?
Yeah.
So someone's asking, can they start a clinic treating patients out of their home? And so, yes, you can. The college doesn't regulate the places where people practice. We regulate the people who do the practice. Having said that, there is a really great resource on our website called Starting a Practice. So if you go to the homepage, you go to Rules and Resources, you scroll down to Starting a Practice, you'll see a list of considerations for starting your own practice. You think about things like maintaining privacy and confidentiality, things like infection control, things like making sure your liability insurance covers you in this type of setting, record keeping, privacy, all those sorts of things. Think about how much you're going to charge, setting up your invoices, those sorts of things. So that's a really good resource to get you started. One of the other things I often tell people who are planning to start a business out of their home is to check with your local bylaws, because cities will have different requirements for operating a business out of your home, which is totally out of the college's control, but it is still kind of a helpful piece of advice. Do you have anything to add to starting a practice in your own home? No? Okay.
That's good. I see that there, and I do get a lot of questions from people accessing our website from countries outside of places outside of Canada, and I'm going to put it out there because it's not really our materials, but I just want to promote. If you're asking about how you can come to Canada, Ontario specifically, and practice physiotherapy, I just want to say to those people asking that there's a great resource, a great website, and I'll always direct you there first, and that's the Alliance of Physiotherapists, the Canadian Alliance of Physiotherapists Regulator, or CAPER. It's www.alliancept.org, and you will see on that website the Alliance has developed a series of resources on becoming a physio in Canada. Every province other than Quebec requires internationally educated individuals have their credentials assessed by the Alliance or CAPER and pass the professional competency examination before a licence is issued. I would also really encourage, if you have anybody asking you or if anybody's wanting to know, they have a free self-assessment tool. You do have to sign up for it, but there's no cost to it, and it'll take you through the process of coming to Canada. You might even want to do it before you come here. So that's my plug. Go to alliancept.org and you'll find a lot of the resources. Or if people are asking you, then you want to suggest they look at that website. There's even resources about the experience of being a physiotherapist in Canada. And certainly as somebody who was educated internationally, I would really have benefited from a little bit of knowledge about the system I was coming to. So, yeah, have you got anything to add to that?
Nope, you handled that well. I've got a follow-up question to the Xrays, and then I think I'm going to ask you another one that came in ahead of time. Okay. So someone's asking about controlled acts, specifically Xrays, and the hospital situation. And so I like this one. So, I mean, they're asking, will physios in hospitals be able to order Xrays, and what's the impact of the Public Hospitals Act? So, it is a challenge because hospitals can certainly have more strict rules than the college does. So, the RHPA will enable physiotherapists to order X-rays, but your employer, like a hospital, can have more restrictions, and they can say, no, we don't want to have physiotherapists do that activity in the hospital. We think it's too risky still. We're gonna only let our physicians do that. So it'll depend on your facility and their interpretation of the Public Hospitals Act. It really isn't a college rule, and we're not really going to have any impact on that. We can let you know what has been enabled in the legislation, but if the hospital or your employer has stronger rules, then you're going to have to abide by those, and it will depend on the facility. All right, I'm going to switch tacks, and we're going to do the bit of a serious question that came in advance, because we do get this one from time to time. We call it duty to warn. Which is kind of an obscure term, and nobody really knows what it's hard for people to find the right resources on our website sometimes. But this question is about, my patient is threatening suicide. What should I do? And I'm going to let you respond to that one, Fiona. I don't know why, but those questions come preferentially to you. I don't know why. It just seems to be the luck of the draw. You get this one more often than Kelly or I do.
Yeah, and having moved into the role, I was surprised at the volume of calls around this question. And since I've been getting these calls, I have been talking to a lot of outside providers, talking to the College of Physicians, I've talked to psychologists, I've talked to the Canadian mental health team, just to get a little bit of a grounding. And what I'm hearing, yes, as physios, a patient it might be the first person they tell about some of the thoughts that they're having. You're working with them in a very intimate, a very physical way, and it might, and probably of all healthcare professionals, spending quite a prolonged period of time with a patient. So don't be surprised that you're the one that they're coming to with this question. And it's alarming. But the first question you want to ask is, what's the immediate threat of suicide? You are a regulated health profession, and you are expected to really try to understand that from the perspective of the healthcare professional and the patient. Is it immediate? Let's talk about it. Are they talking about, I just feel hopeless today, I feel like ending my life, I feel that it's not worth living? Then that's slightly different than a patient perhaps who is coming in and saying, I've had it, I'm going home, I know how I'm going to do it, I've got the pills ready, I'm just telling you I'm not going to be in for the next appointment. And they really do have a plan in place. You want to do something about the second scenario, but the first scenario, when they're talking about their hopelessness, you're the physio providing their care. Do you have maybe leaflets in your clinic? Do you have numbers? Do you have a support system you can connect them with or offer to connect them with. You can ask for their consent to take this information to talk to their GP, to talk to the social worker, to get them the support and services they need. So just because they've told you that information, be very clear that you are not the right person. We do not have the right training to help this patient through this crisis in their life. They might say to you, okay, go ahead, contact my physician, contact my social worker, great, go ahead and talk to the team to get the supports they need. But very often the patient will say, no, I've told you this in confidence and I expect you to keep it in confidence. So if you've decided their threat of suicide, it's not imminent, there's definitely a cry for help. You're going to try and get them leaflets, you're going to try and get them numbers of resources you can connect with them. I've put on the college website some numbers that you can have handy in your clinic. Because this is asked so many times, we decided to create a page where you can find numbers, you can find some information on this. Then do connect them. But so now you have the threat's not imminent, the patient's saying they want to keep it confidential, then you have to decide to keep that confidential, and that's really hard. Your hands are tied. But remember, if we're moving on where you believe they're lonely, they don't have a social network, they don't seem to have people to talk to, they've got a real reason to want to commit suicide, they've got means to commit suicide, then you may break what Sherry was saying, the duty to warn. At that point, you want to then break their confidentiality. Maybe you're contacting the GP. Maybe, if it's so imminent, you just phone 911, you get an ambulance there. And I know there has been some physios that have done that. But make sure when you take that considered measure, you can really provide rationale for why you're doing it. You believe because of the means, because of the reason, the means, the intent of the patient, you really believe the threat is imminent, then you can break confidentiality. So sorry, I seem to be going on about that. I do feel for the physios that are in that position. And if you do have questions or you need some resources or you need some numbers, I could provide that for you. And we also have it on the college website. Can you add to that? That was a bit of a ramble.
No, I don't think so at all. Maybe I could summarize. So ask the patient if they want help. If they're competent to make decisions and they say no, and there's no immediate risk of harm to them or other people, then you do nothing. If they want help, direct them to the right place. And if you believe that there is a serious risk of harm and that risk is imminent, and they tell you don't contact someone, you are able to break confidentiality in order to contact someone and keep them safe.
Thank you, Sherry. Always concise, straight to the point. Thank you.
I just mimicked what you said. That's all. That's all.
Okay, I'm going to fire one right back at you. What about, because this oxygen administration keeps coming up, I'm going to just switch a wee bit. Somebody's asking, can a physiotherapist who treats patients with chest conditions, I imagine pneumonia, can they administer medication such through a bronchodilator? Can they do that?
Yes, as long as they meet certain conditions.
Mm-hmm.
So again, the Controlled Act is administering a substance by inhalation. That substance needs to be ordered by a doctor. So if the physician has ordered the medication, you can administer it as long as you are competent and have put yourself on the roster.
Okay. Thank you.
How about another one?
Yeah.
Give me another one.
Okay.
This is my favorite question.
Can we offer reduced rates to a patient who just doesn't have any insurance, any extended health benefits?
This is my favorite question to answer.
Yeah, okay.
Yes, you can absolutely lower your fees.
Why not?
And give the same great service. It's always in patients' best interest to receive great care at a lower price. So yes, you can offer discounts to patients. I love dispelling that myth.
Well, can I charge more if I know that they've got extended health?
No, you cannot. You can only lower your fees. You can't raise someone's fees just because they're rich or have a really great benefit plan. Set your fee, decide what you expect to be paid, then you can lower it if they're challenged.
Okay. Oh, here's one I'm going to take because I've been going
near and dear to your heart. I'll ask it to you. I know what you're going to ask. Are physiotherapists who are approaching retirement able to decline to participate in our quality assurance practice assessment, including the revised changes, maybe the mini review that's coming? And if they can decline, how long before they then have to stop practicing?
Okay. I know the policy is that if you're going to retire and you put in writing to us that you plan to retire within the next upcoming year, then yes, we can take you out the selection pool and for the moment. But what I'm doing is putting you on hold, because after the year I'm going to check whether you are registered and practicing, and if you are, then you're automatically back in the pool to go through a practice assessment. Why do I say that? 2 reasons. Because lots of people decide they're going to retire, but then they change their mind. And that's okay, that's your right to do that. But we also don't want people using it as a way to get out of doing an assessment. So there's the answer. You can defer you can defer the assessment. But if we find out that you've chosen or you're still practicing after a year, then you're automatically in the assessment. You can't do it again, by the way. You can't say, oh, well, a year's passed, but maybe I'll retire now in another year. No, that's not going to work. You have to, after 1 year, participate in an assessment. So hopefully that answers it. If I can just plug as well, because it is a question about the quality assurance, the peer assessment, we are in the process, as Sherry alluded to, of looking at a different type of assessment. So in the end of March, on March 17th, Council will have a new model put in front of them, and they will decide whether this new remote type of assessment will be the new model that this college uses to assess physiotherapists. The communications team have a survey that I think is closing on the 28th of February. Please take your time. We want your feedback on that model. I've been going around the province collecting information from physios. I think we've got a lot of information on it, but if you've got anything else to add, please go to our college website, go to the last perspectives. There's a link to a survey. We really want to collect your input on the profession's peer assessment that we're using. Okay, moving on, back to questions. That was my plug.
There's a couple of follow-up questions. One is about rostering, and someone who's come to Canada from another country, and they want to roster for one of the controlled acts, and can they use their experience from their home country? And the answer is yes, you do. You know, your education does not have to have been taken in Canada. So that one was
no boundaries.
Pretty easy to deal with. Follow-up question to the fees and billing. Can we offer free physiotherapy? Yes, you can.
Can you ask them where they're working?
If you want to offer pro bono, we call it pro bono. I don't know why. Wish I knew that. Wish I'd looked that up. The history of pro bono. Yeah, probably. But yes, you can offer to treat someone for free. So we talked about you can treat them for a reduced rate. Yes, you can even offer it for free if you wanted to. Another follow-up question about billing and how to set your fees. And the question is, can we bill based on the amount of time we spend with someone? And so we don't have rules on you must bill this way. The standards say you have to set the fee that you expect to be paid. You have to have it written down. You have to explain it to patients before you start treating them so that they can understand the financial implications of their treatment. And your fees need to be reasonable. You can't overcharge or charge excessive fees. Some people will charge per appointment and expect people to be there for 20 minutes or half an hour or an hour. The range is all over the place. Other people will charge for a block of time. So there's one fee if you're here for 15 minutes. It's this if you're here for half an hour. So yes, there are lots of different ways that you can bill or charge for services, as long as you have it written down, it's clear what you expect, and you've explained it to patients. Did I miss anything?
No, that sounds good. We get this a lot, and it's about how do you decide how much supervision you need to provide to physiotherapy assistants, to students, to physiotherapy residents. So I'm just going to tackle them one by one. There's sort of different things we're looking at. But
can I make a suggestion?
Mm-hmm.
Walk through the whole deciding what can be assigned to the assistant, how you communicate that, how you supervise it, can you do it remotely? Those are as a package of questions, because those are really common.
So what can you assign? I always like to be a little bit personal here, but a physiotherapist, when you design that care plan, that treatment plan, you know what that physiotherapist needs in order to address the diagnosis and to meet the goals. You know exactly. So you need to find out if the assistant that you're assigning is competent. What does that mean? Are they trained? Do they have knowledge? Have you ever watched them doing what you're going to assign to them? Can you really be assured that that patient is going to get that quality of care that you know they need to address their concern? So that's the first thing. You would never assign anything unless you've directly seen the assistant doing it, or you know about their knowledge and about their training. Number one, communication. You need to set up some form, and it doesn't have to be complicated or difficult. You have to have a form of communication. You have to have a number available that assistant can contact you any time during a treatment if a question is raised, or if the patient requests to speak to the supervising physiotherapist about the treatment plan. There should be a number available that reasonably an assistant can get hold of the physiotherapist. The patient, very importantly, what about the patient's condition? If you're working in a sports clinic, if you have a highly competent assistant, you have a very stable condition, you might be able to supervise that patient and the assistant remotely, for sure. But certainly from my experiences, my work experience, I worked in acute care often, where patients are changing. They're changing sometimes by the hour, by the day, and I would never have been remote to that assistant for the patient conditions that I see. So are they stable? Are they chronic? Are they likely to change? What's the risk? All of these are things that the physiotherapist needs to determine and consider before they decide whether it's remote supervision or not. We're not looking at a rule written on a piece of paper. That's one of those rules that up to you, the physiotherapist, to determine and be able to, if asked, be able to explain why the supervision took place that way. Now, that's competency, that's communication, that's remote versus not. What else did you ask?
It was just about the package of, like, when you're thinking about assigning treatment to an assistant, what are some of the things to consider? And so, yes, you do the assessment, you get patient consent to involve the assistant, you decide what the treatment is, you assign it specifically to the assistant that you've already ensured is competent, you supervise what they do, you follow up, you keep records, you include their name and job title on invoices, you have to meet every aspect of the standard.
And so what if you're feeling uneasy? I know, Cher, you've taken a lot of these questions. If you are being interviewed for a job at a place of employment where it's automatically built into the contract that you'll work there for 2 hours a week, all patients will have an assistant assigned to them. What do you think about that?
Usually I ask people how they feel about that. How do you feel about just doing assessments and having someone else do all the treatments for you? Does that feel like physiotherapy to you? What is it about the treatment that they're getting that makes it physiotherapy? I usually ask them things like, Well, what if a patient actually needed a physiotherapist? What if their condition was so acute, or their needs so high, or the skills so specialized that they had to be treated by you? How would you be able to accommodate those patients? And then I asked them about how are you going to be able to supervise these people? You need to be available to intervene if the patient or the physio or the assistant needs you. So if you're only working 2 hours a week, how can you legitimately be available to supervise if you're not working? Or worse, if you're working someplace else and your attention is on a whole other type of caseload. So usually I tell people to be very careful about accepting a job like that.
Yeah.
What else have we got here?
I think
We're actually are getting
close to.
Ooh, wow! It's almost 1 o'clock. I can't believe it. We got through most of the questions. I'm pretty happy with how we did. We got through most of the ones that came in advance, and how, I feel like we did that one with the
check billing.
Yeah.
Yeah.
Or we can do it now.
So there's a question that came in: how will I check my billing? I work in a private clinic. Again, as Sherry had said, I think earlier on, when you start work, we hope that you've set up in your contract, you've had that conversation exactly about when your registration number can be used for billing purposes. You know that, and that's the process that's set up. You also need to say to the employer, I need to have access to check how my registration number is being used and when. So you might want to take a list of patients in your last week that you saw. Maybe let's say 10, you see 60 patients a week. Let's say you, and then really it's up to you, but let's say you take a list of 10 patients. You will look exactly what they were billed. You would look at the patient record and their attendance, and you would check the dates that they were billed and what they were billed for, and make sure there's a match and there's no error had occurred. You then want to document that process. So keep a diary of your auditing, the date, what you audited, and what you found. Was it error-free or was there errors, and how you fixed those errors. And that will become your record of auditing of your own number. I would suggest that because if there is a problem later on, you can show a diary of how that you took the responsibility to audit the billing using your registration number. So hopefully that's one way of doing it.
I think we're going to have to
wrap
it up. Like we're like 3 minutes to 1. So we got through most of the questions. We got through most of the ones that were submitted in advance, and most of the ones that came in advance. And our apologies to those of you who didn't have your direct question answered. If we didn't get to your question, feel free to send it to us at practiceadvice@collegept.org. Oh, there you go. Our contact info is on the screen. So send us the question again, and we'd be happy to answer it for you.
Or that direct line, 647-484-8800, or the toll-free number that you see there, 1-800-583-5885. And as we said at the beginning, we're trying to offer a service 8:30 in the morning until 5 p.m. Monday to Friday. We hope to have one of us a live call to answer your question. If not, we hope to get back to you the same working day or the morning of the next working day. That's our goal. If we don't have the answer for you right there and then, we do commit to doing some research and trying to get that answer for you to work through the issue or concern that you brought to us. Okay, so with that...
Is there a survey?
There is a survey that we would like you to complete.
And we're going to email that to you? Is that what happens? Oh, there we go. It's on the screen now.
So on the screen, there's a survey. We're trying to improve our practice. We're trying to make it as useful as possible to you. So any feedback you can provide us, we'll be very grateful. Please complete the survey and send it in. And with that, I think we'll wrap up our session for today. And thank you for tuning in.
Thank you.